Fluoride can be taken into the body by normal water intake in fluoridated areas, fluoride tablets, fluoridated foods, toothpastes, tooth varnishes, and mouthwashes. The purpose of this intake is to have fluoride ions present in the saliva. When fluoride ions are in the saliva, when the teeth remineralize, instead of forming hydroxyapatite like we mentioned before, they form fluoroapatite. Fluoroapatite is more resistant to the loss of minerals compared to hydroxyapatite, even in acidic conditions. Not only this, even if there is an acidic environment, having fluoride ions in the saliva still promotes remineralization. So if you've understood that caries occurs by a process of demineralization occurring more than remineralization, it should make sense that after the introduction of fluoride and the formation of fluoroapatite, which is more resistant to demineralization than hydroxyapatite, and that it promotes processes of remineralization, fluoride use is an excellent way to reduce the risk of caries. So in regards to the systemic effects of fluoride, I've read studies suggesting that fluoride contributes towards reduced cognitive function. It's been speculated that it could promote hypothyroidism in those who are iodine deficient because fluoride tends to compete with iodine in the thyroid gland. I definitely feel like there needs to be more extensive research into the overall systemic effects of fluoride with larger test groups, as a lot of the studies I read only showed a very small sample size. Even though there's still some research showing potential negative consequences of fluoride systemically, there are hundreds of research papers showing the dental benefits of fluoride. What you have to remember is that there's so many emergency room visits associated with dental pain. So the patients have excruciating pain because of extensive decay, abscesses which need to be drained, or they need to take a course of antibiotics. Then they actually need to treat the teeth, which is either costly if they go the route of having a root canal or a crown, or the cheaper option of an extraction, which means they have missing teeth in the mouth. And that can affect the way they bite and how they chew. Had the patients received proper education in regards to their diet, oral hygiene habits, and appropriate fluoride therapy, I feel like a lot of these situations could have been avoided. So that's my stance on fluoride. If you're adamant on avoiding fluoride altogether because of the systemic consequences, then you need to at least ensure that you're being very meticulous with your oral hygiene. So you need to be ensuring that plaque doesn't build up on your teeth, and that if it does, it needs to be removed as soon as possible. I still recommend a fluoride protocol in the mouth only, so that means using fluoridated toothpastes and mouthwashes. Fluoride tends to remain in the saliva up to 5 hours after use, so that would definitely have a beneficial effect on reducing your risk of dental caries. Additionally, local fluoride use in the mouth causes a very minimal rise in blood levels of fluoride, so if you are worried about the systemic effects of fluoride, this may be a safer option for you.